Welcome to Conversations with Sekani, a podcast for people in their 20s who are trying to figure out life and not get lost along the way. Today's guest is someone who truly embodies service, compassion, and transformation. I'm joined by Julie Simmers, a patient safety expert, visionary nurse leader, and transformative educator whose work is shaping how healthcare is delivered, experienced, and improved. Julie has spent years on the front line of healthcare, not just treating patients, but working to transform healthcare systems, leadership, education, and patient safety culture. So, in today's conversation, we are diving into the human side of healthcare. It's so nice to have you, Julie. Welcome to Conversations with Sekani.
Thank you. I appreciate being here.
All right. So, for people meeting you for the first time, who would you say Julie Simmers is, and what led you into healthcare, basically?
It's really defined the majority of my life. I went into nursing right after high school at my mother's suggestion, and it's been a decision that I've always been really glad I made. And I've
Mm,
been able to transition from one aspect of helping patients into another over my career, whether it be, different locations in healthcare, the ICU, um, the trauma helicopter. I spent 10 years working in different departments. And then I entered nursing education almost 17 years ago. So that's been a journey as well. But, teaching nursing students how to be caring and compassionate, but safe nurses.
wow. All right. So, was there actually a particular moment for you that made you, want to like make people be more caring or something? I feel like that should be triggered by something, right? So, was there a moment that made you decide that?
Nursing is all about compassion and
Mm,
healthcare, right? And sometimes it's not a part of somebody's usual way of being until what I like to do is help nurses and healthcare providers understand that that patient that we're taking care of is somebody's mother or father or brother or sister. And so we have to step back and not out of the rat race, the routine, the
mm,
craziness of just doing tasks, but
mm.
realize what we're doing is with a human being. And kind of like the golden rule, do unto others as you would have them do unto you, right?
Yeah, exactly. Okay. So, what did your early career as a nurse teach you about humanity, basically?
Everybody is going to be vulnerable at one
Mm,
point in their life, whether it's being a patient, whether it's receiving a diagnosis of cancer or, receiving news that your loved one was harmed in a car
mm,
accident. And it really is understanding that we all go through pain as well as joy, to be compassionate and understanding and help those people that are in a different phase of their
mm.
life of what's going on, to elevate them into being able to cope and to manage and to get through sometimes the rough times.
So, what does patient safety truly mean beyond protocols and, policies, basically?
So when I started research into the topic when I was obtaining my master's degree back in 2009, what I found in the literature really surprised me because I'd already been a nurse for 30 years. I had no idea that medical harm was the third leading cause of death in the US.
Mm,
We have heart disease and cancer and then medical mistakes. And to me, this has been going on for decades. I just didn't understand why, if we know about it, why can't we solve the problem? And that's what began my journey into this current place in my life was trying to understand where harm occurs and what are the interventions that we can do to prevent it. So part of that this last couple of years has evolved into helping patients and families become aware of what is normal, what is expected, what is not normal, and really how to find their voice to speak up. Because one thing I know is that patients and families or loved ones know the patient better than any healthcare provider. They know their little nuances of what's
Mm.
normal, and healthcare providers need to listen, which is what I talked about in my TEDx talk last January, a year ago, is that we need to listen, but patients and families also need to speak up. And I know a lot of them are intimidated, thinking the doctor went to 12 years of school and nurses went to 4 or 5 or 6 years of school. And what do I know? I'm just a, secretary, or I'm just a, in a different profession. But it really is important to share, because one thing we found was that 70% of patient harm events are due to communication breakdown. So that could be between a doctor and another doctor, between a doctor and a nurse, but it also includes the family. And so we have the opportunity to speak up and say, hey, my mom isn't acting like herself. This is not normal. We need to investigate what's going on. Can you assess her? Is it her oxygen? Is it her blood glucose? Is it, infection? What's going on with my mom? Something's not right.
Okay. I feel like this is what you're doing is actually solving a whole lot of problem in the healthcare world, right? And I
Yeah.
think it should actually go global, right? Okay. So I was going to ask, what's your biggest safety challenge the healthcare system face today? What's the biggest safety challenges?
Yeah, well, communication is obviously way up there, as we just talked about. But the other really big one is medications. There are so many opportunities to make a mistake with medications that can seriously harm a patient. I do a lot of social media posts, and one I did a couple nights ago was about a dose of medication that the doctor wrote. The decimal was in the wrong place. The pharmacist ignored the warning on the computer, and this poor lady got this dose of medication for 4 days in a row and got extremely sick and eventually died. And it's, all opportunities, areas of
Mm.
whether it's prescribing area errors, whether it's dispensing errors, maybe the nurse doesn't do a double check on the right patient. In nursing school, we teach there's 6 steps to safe medication administration. And sometimes they take shortcuts. So it's the right patient, the right drug, the right dose, the right route, those kinds of things. And sometimes they skip those steps, and mistakes sometimes don't cause harm. Sometimes those medication mistakes can harm someone seriously, and sometimes it can actually kill them. So I think, as a patient's family member, if you're in the hospital, I would always suggest, what pill is that you're giving my mother? What is it for? What should we watch for? And let's just say, for example, maybe it's a hypertension or high blood pressure pill. You can always say, well, her blood pressure looks normal right now, or this is lower blood pressure for her than usual. Should we really be given that pill? Just asking the questions in a way that's trying to be collaborative with the healthcare team.
Always ask questions, right? Okay,
Yes.
because I think I know a family member, right, that had stroke. Yeah.
Mm.
Then the kids, this is an elderly person. The kids are my cousins. And I was like, what's wrong with your dad? Said, I don't know. They said, I was like, are you serious? They said you should actually ask them, like, what are the things, what's going on with my dad, what are the things that we should do to make him get better. So I feel like there should be awareness out there that people should always ask these healthcare personnel, like, what is going on, or is this okay, right? So I actually do
Yes.
agree with what you said. Okay, so
That is really important, what you just asked, because if, the kids or the caretakers know that their dad had a stroke or their grandfather had a stroke, they can ask questions. what should we do? What should we watch for? What kind of help can we give? And
Mm.
when should I call the doctor if, you see something concerning? What kinds of things should we watch for that could mean, the patient is deteriorating or not stable?
Exactly. Well, okay. So I would like to ask, what does, visionary leadership mean in healthcare?
It's actually seeing beyond where we currently are. And if we look at where we currently are, we do have, in the US at least, many healthcare problems. And so being a visionary to me is, and I'll just use myself as an example, when I know that medical harm is a problem, and I also know that nurses currently aren't getting the quality of education in many schools to actually become a safe nurse. So that's the opportunity I took to start helping and creating my business, to help patients and families, but also help nurses by closing that knowledge gap, and providing education of what they really need to know to then safely take care of patients. So being visionary is seeing a problem or seeing a gap, and using your knowledge and experience and education to do something to close that gap. And then, work with other leaders that are in the same position to be able to create change.
Wow. You know, I think that, in fact, I know that you've been on a couple of podcasts before as a guest, right? So I would like to ask, is there a particular question you expect people to ask you, but they've not actually asked you? Or is there something you like to speak about?
Yeah, a lot of what I share is really sobering and sometimes even depressing stories or statistics. But what I want to convey is that there is hope. There is hope when we become informed and we become educated and we learn to find our voice, whether we're a healthcare provider or whether we're a patient's family or loved one, that I think the power of the people is so important to recognize, because if we feel all alone and we don't do anything, and that's everybody, then nothing's going to change. And so understanding that we can impact in a positive way as an individual, but it's like, what was that old analogy where the rock is rolling down the hill and picking up moss, and the more it rolls, the more moss it picks up?
Yeah.
It's, creating really, a grassroots movement that demands change. And I think, there's a lot of healthcare providers that feel threatened if a patient's family asks questions or says, we need to assess my mother again, something's wrong, and not taking oh, she'll be fine, not taking that answer and escalating up. Well, who else can I talk to because I know something isn't fine? Um, Taking that stance of we have the power to create change. And I think the more people learn this, which is why I love going on podcasts to share this, but the more they learn this and the more people that actually use their voice and speak up, then healthcare is going to begin to expect it. Right now, they expect us to be silent partners sitting in the corner of the room, or silent bystanders. And it's just, it's too it's too complex of a healthcare system not to engage everyone that cares about that patient. I'm not saying healthcare providers don't care, they do, but they're caring for, a nurse may have 6 or 7 or 8 patients, and you, if you're a loved one, or a family member at the bedside, that's the only one you care about. So you can focus your attention and say, I'm really concerned. My dad is way sleepier than he was yesterday. What's going on? It doesn't seem normal or natural or right.
Okay. Wow, thank you so much. I feel like this has been really, really inspiring, actually. And my final question actually is, what would you define success as?
How would I define success?
Yes. What is success to you?
Yeah, it is impacting the environment that I work in, that I live in a positive way. And to boil it down to super simple, is saving patients' lives
Mm.
with the tools that I share to patients, families, and loved ones so that they can make a difference. And, I really get emotional when I talk about it because there are so many stories of patients that have died and leave devastation behind them. And if I can change one or 10 or 100 or 1,000 lives, then I've served my purpose.
So I've asked a whole lot of people their definition
That's
of
okay.
success. And I must say, your
Yeah.
definition stands out. Basically, it does because it means caring for others, right? And
Yeah.
that is really, really inspiring. And yeah, I
Thank
like
you.
that, basically.
Thank you.
So, where can listeners get to know more about you?
Yeah, my website is drjulie Siemers.com. And then all my social media is drjulie Siemers on TikTok, on Instagram, on Facebook. So those places I share as much as I can with people. And I bet you would learn something listening to some of those short stories. Yeah, that's my hope.
All right, thank you. Thank you so much. So I'll definitely be visiting your website actually to check it
Okay.
out. All right.
All right.
Yeah. So thanks for tuning in to Conversations with Sekani. If this episode sparked something in you, make sure to share to someone who you think might need this and also subscribe so you don't miss out on new episodes.